a story that we did last year about new breast cancer screening guidelines, the ones that urge women to schedule their mammograms more frequently. There was a bombshell new study that cast some serious doubt on the effectiveness of the screenings. Dr. Siegel, the mammogram specifically?
Yes, Jim, you know, I have some big reservations about this study, although I want to start out by saying it looked at 90,000 women in Canada, and it did a randomized trial, which we like, where they put one half the women in a group where you got breast exams, the other half in a group where you got mammograms. And they found that 25 years later, after 5 years of screening, 25 years later, the number of women that were alive who had gotten the breast exams alone were almost as high as those who had gotten mammograms. But, and here's the big but, and I know you want a bottom line here. Jamie, I would not change one thing. I think women should get mammograms. Why? First of all, breast exams are unreliable. I love to do breast exams and diagnose nodules and send people for, but what do you do then? You send for a mammogram. Another thing this study showed was that those where you found a nodule on a breast exam, they were bigger already. Well, here's the bottom line, and we've talked about this with prostate. Here's the bottom line. You want to find breast cancer before it escapes the breast. It's called early detection. So the goal of a mammogram isn't exactly to save lives. The goal of a mammogram is to get cancer early. Every woman out there, I think, would want to know.
What are your guidelines then, Dr. Siegel? When do you start and how often do you get it? If you have a history in the family and if you don't?
I start at the age of 40 because the most aggressive breast cancers are in the 40s, and those from 40 to 50 have been shown a higher rate of mortality if you don't do the mammograms. I continue at least till 70, 80 years old. I like to say once a year, and I'll tell you why, for a funny reason. If I tell women to get mammograms once a year, they don't get them once a year. They get them once every year and a half. If I tell a woman every other year, forget about it. They're going to forget about it completely. I want women out there to get their mammograms every year because that's the way I can make a comparison. Now, if, and this is my last point, I'll shift it over to David, if we have too many false positives and we have too many doctors out there doing biopsies and treating people unnecessarily, which this study also showed. Jamie, the fault is with the doctor. It is not with the mammogram. The mammogram provides information we need.
That's what I wanted to ask you, Dr. Samadi. Two things. One, is a mammogram only as good as the screener? How do you pick the right person to do a mammogram and know that a center has the right equipment? And is there any reason to be afraid of getting a mammogram?
Well, look, I think the criticism of what Mark was just saying is that you're going to find some false positives, which can lead to some of the treatments and may be not necessary. So that's why they say be careful with mammograms. Of course, the experience of the person who does it plays a big role over here. But look, this is not the confusion among the patients. The doctors are also confused. This is a big debate on a national level, big controversy that's going on among all of us. And now people are watching, saying, like, 1 week you're saying get mammogram, the other week you're saying don't get mammogram. So where do we stand? I think that tailored screening, I think that personalized medicine, I think looking at all of us in a different species. Not every breast is the same. You have younger breasts that are very dense. You have some older ones that may not be the same. Now, this study is from Canada. I'm not saying that the breasts in Canada are different than in the U.S., but the technology that was supposed to be funny. The technology that they have used there 25 years ago, mammograms at that time, they were simple mammograms. Now we have digital ones, and guess what? There are three-dimensional mammograms coming from Mass General that's detecting, this is what I'm getting to for your answer.
I like it. I can visualize it.
Detecting 7% higher chance of getting breast cancer. Well, that's going to change the result of this study. Now, our experience 25 years ago is the same as now, so I want people to be careful. American Cancer Society is recommending getting your first mammogram at the age of 40 and every other year, sorry. If you get the mammogram, talk to your doctor before you jump in, because a lot of these nodules may or may not be cancer.
Quickly before we go, Eric's going to ask, and I want to know as well, when can we go to our doctor and ask for that three-dimensional mammogram?
It's coming up. Right now it's being offered in Mass General. Other hospitals are going to look into it. But I don't want people to be confused, because this is really sending it wrong. And we have the same issue with PSA. We have the same thing with prostate cancer. And by the way, since last week, when we told people to call in about their prostate cancer, we were able to help hundreds and hundreds of people. And that's what's going on with a lot of breast cancer doctors.
Just to highlight your final point here, The technology has changed. This study was looking at 1980s. Right now we have digital three-dimensional mammograms. We need this information. If you do a breast exam alone, I don't have scientific information. Mammograms give me that scientific information. Then I have to decide what to do with it.
And by the way, one last thing, MRIs, Jamie, sorry to, I know time is, MRI is also another one that we use to complement the mammogram.
I don't want you to be cut off by our master control, but we will talk about any other thoughts you have on that topic on the other side.